Hello, and I'm Dr. Eric Cedar for Physioform. Ever wonder what scapulothoracic rhythm may have to do with jaw pain? I had a case one time where it was a home health nurse actually came into the clinic straight out of the gym. We have a clinic that's inside of a gym-based facility, so people walk through pretty frequently, so it's not uncommon to have that inflow-outflow. So was walking out of my office after having just seen another patient and heard this lady at the counter saying, "Hey, do you guys do anything about jaw pain?" So I'm happy to walk out, said, "Absolutely, we do a lot about jaw pain." So ended up bringing her in, doing an evaluation, and one of the things that we teach in our courses is that you always want to start by assessing the spine and the shoulder girdle in TMD cases. It may not be the most obvious place to go first, but it's really important. She was a perfect case in point. So had her turn around, face the wall, just doing a general inspection of posture. Through the shirt she had on, I could tell her left scapula was winging way off, and her pain was all on the left side. She had a 2-year history of this left-sided facial pain, jaw pain. She had been to see a couple of dentists, had 2 to 3 splints fabricated, was a sleep bruxer, so she clenched and grinded at night, was currently wearing a splint at night, but all this pain on the left side. And right off the top, just looking at her general inspection of posture, scapula way off, and her familiar jaw and headache pain was most provoked with palpation of myofascial trigger points in her left upper trapezius and levator scapula. So right off the bat, we've got this scapulothoracic rhythm issue, and when we looked at her actively, it was even worse. She had very poor eccentric control of the scapula, serratus anterior very weak. So a lot of her intervention involved myofascial release to the tissues that were involved, but most importantly, scapulothoracic strengthening. Did a lot of lower trap, a lot of middle trap, some taping techniques, all types of different things. Basically tried to build a better base for her, and that was really what ultimately resolved her issue, and surprisingly actually helped her with her clenching and grinding too. So not somewhere you always look right off the bat, but definitely a very important component of TMD management. Hope to get a chance to see you all in class sometime where we delve into more of that dynamic relationship and try to help illuminate how to best manage these people comprehensively. So thank you so much. I'm Eric Cedar for Physioform.